Good morning. I'm Chris Ballard, the MPP for Newmarket Aurora, and I want to thank everyone who's here today to learn and support brain tumor awareness. I'm honored to introduce my private member's bill, the Brain Tumour Awareness Month Amendment Act. If passed, this bill will proclaim the month of May as Brain Tumour Awareness Month. This is not new ground. Currently, October is designated by the province as Brain Tumour Awareness Month, but by designating May, we will align Ontario with both British Columbia and the United States to create a North America Brain Tumour Awareness Month. This joint cooperative coalition will create greater awareness of and support for this cause. It's important to recognize this Awareness Month is just the beginning of what needs to be done to address this terrible disease, a disease that impacts the lives of thousands of individuals and families each and every day in Ontario and across the country. I'd like to thank a few key people for their support and guidance during the identification and creation of this bill. Amy Mathias, the Digital Community Engagement Coordinator from the Brain Tumour Foundation of Canada. Maureen Daniels, a board member also from the foundation. Charles Mott, a brain tumor survivor from my riding of Newmarket Aurora, and Ben Diplock, a clinical research coordinator at Sunnybrook Research Institute, who is also a brain tumor survivor. And I will say, just as an aside, I've known Ben since he was quite young, actually. He grew up on the same street that I was raised on in King City, and my parents kept me updated on Ben's journey and progress, and I know Ben's parents would be delighted, happy to see him here, and I know my mother, Ben, is really excited to see you here today, so congratulations. Brain tumors are not just an issue that typically receive a great deal of attention from the public. The goal of this bill is to start a conversation about brain tumor awareness. We know it's an illness that can affect anyone. The brain, of course, is the most important organ in the body. It controls our five senses as well as the ability to speak and move. Brain tumors are surprisingly common, and the symptoms can be subtle. Every day, 27 Canadians hear the words, "You have a brain tumor." An estimated 55,000 people across Canada live with brain tumors. One of these individuals was Evan Leversage. Evan was from the small community of St. George near Bradford. Evan was diagnosed with an inoperable brain tumor early in December 2015, and the doctors told Evan's family that they were unsure he would live to see Christmas, and perhaps they should celebrate it early. You'll probably remember the community's reaction. It came together in an outpouring of love and support for Evan and his family to ensure that Evan celebrated that Christmas. An estimated 7,000 people joined that celebration, more than double the population of St. George. Supporters lined Evan's street, cheering as he passed, homes lit by Christmas lights, decorations, and even fake snow. It made all the news. The photos of Evan sitting next to Santa in his sleigh with a smile on his face were magical, and I was so pleased to be able to make a statement in the House recognizing the people, the great people of St. George for that event on behalf of Speaker Dave Levac, whose riding St. George is in. Sadly, Evan died in December, but his memory and the memory of that magnificent event carries on. Brain tumors also impact the strongest in our communities. Newmarket Hurricanes player Kevin Lord died in 2006 of brain cancer. Kevin was a dedicated player, a teammate, friend to many in both hockey and ball hockey communities in my riding of Newmarket Aurora. So each year the Newmarket Hurricanes, an Ontario Junior League hockey team, holds the Battle of York, and benefits from which goes to the South Lake Regional Hospital's Cancer Centre. The Hurricanes play the Aurora Tigers just down the street, and it's fantastic to have the two towns in my riding get behind that event. And the event is in memory of Kevin. Top of mind as well is the announcement recently that the frontman for the Tragically Hip, Gord Downey, has an incurable form of brain cancer, and we are all stunned. Gord's family, friends, and fans have rallied around him as he vows one final tour with the band. It will be a remarkable tour. When you look at the stories of Evan and Kevin and every other person who has lost the fight against brain tumors, and those who have survived, there are generally few similarities. Brain tumors do not seem to target a specific type of person. They don't discriminate between young and old, women or men. It appears that there is simply no reasoning behind it. This private member's bill is a product of conversations between myself and organizations such as Brain Tumour Foundation of Canada. This terrific foundation organization was founded in London, Ontario in 1982 by Steve Northey, who lost his 8-year-old daughter Kelly to a brain tumor. It was co-founded by Dr. Rolando Del Maestro, a neurosurgeon, and Pamela Del Maestro, a neuroscience nurse. Since its founding over 34 years ago, Brain Tumour Foundation of Canada has been dedicated to helping find the cause of and cure for brain tumors. The Brain Tumour Foundation of Canada is also an active participant in the International Brain Tumour Alliance, which works with organizations in over 100 countries around the world. Those organizations focus on raising awareness of brain tumors, advocating for positive change, and supporting brain tumor research. Through conversations with Brain Tumour Foundation of Canada, I've learned that one of the biggest hurdles in finding a cure is the lack of data. To date, Canada has relied on data from a number of American and Canadian resources to guide Canadian research, raise awareness, secure government funding, and provide support programs. This data is not a true reflection of Canada's brain tumor community. In moving toward a cure, Brain Tumour Foundation of Canada established the Canadian Brain Tumour Registry in November of 2012. This project will count every person with a brain tumor in British Columbia, Alberta, Manitoba, Ontario, and Quebec. That group accounts for approximately 90% of the brain tumor cases in Canada. Having this information will accelerate advocacy efforts to ensure equal access to drugs, treatments, and services for all brain tumor patients. Collecting this data will bring us one step closer to finding a cure. Our government understands there are many steps we need to take to fight brain tumors, including investing in learning more about the brain's function. That's why in 2013, the Ministry of Health and Long-Term Care and the Ministry of Research and Innovation partnered to provide the Ontario Brain Institute with up to $100 million over 5 years. That's $20 million a year. This funding is helping to sustain and expand the Ontario Brain Institute's coordination and commercialization support for neuroscience research. However, there is always more work that can be done to further the conversation, which is why I'm presenting this bill today. As I mentioned at the opening, for several years, the month of October has been recognized as Brain Tumour Awareness Month in Ontario. In an effort to raise the profile of this disease, the Brain Tumour Foundation of Canada has chosen to highlight May as Brain Tumour Awareness Month, aligning itself with the United States and the province of British Columbia to create a North American Brain Tumour Awareness Month. If passed, this bill would see Ontario declare May as the Brain Tumour Awareness Month. I encourage other provinces to also put forward a similar bill in order to continue to build momentum for this cause across Canada. Personally, I'm putting forward this bill for people like Evan and Gord Downey and Kevin Lord and Charles Mott and Ben Diplock and every other person who has faced this terrible disease. I want to make one final comment. Ben and Charles have proven that brain tumors are not always fatal. When an Ontario resident is told you have a brain tumor, it need not be a sentence. It is my hope that this bill in some small way will help in brain tumor prevention and cure, and it will help raise support for those living with brain tumors. So thank you all for being here today, and I'd like to introduce Maureen Daniels. Maureen is a registered nurse as well as the coordinator of the Jerry and Nancy Pencer Brain Tumor Center at Princess Margaret Cancer Center, and a director of the Brain Tumour Foundation of Canada. So Maureen, I'll turn the floor over to you for a few remarks, and thank you for being here.
Thank you, Chris. And good morning, everyone. My name is Maureen Daniels, and I am a board member of Brain Tumour Foundation of Canada. It's my pleasure to be here with you this morning. We are here, gratefully here today, to raise awareness of brain tumors. Brain tumors are more common than people think. As Chris alluded to, there are an estimated 55,000 Canadians living with a brain tumor, and every day, 27 new Canadians will hear the words, "You have a brain tumor." Brain Tumour Foundation of Canada was established and is here today to help those affected by brain tumors by providing support, information, and to fund life-changing research. The mission of Brain Tumour Foundation of Canada is to reach every Canadian who has been affected by a brain tumor through support, education, information, research, and yes, advocacy and awareness. Brain Tumour Foundation of Canada's vision is for a future where we won't have to be here because we will have understood the cause and have a cure for brain tumors. Until that moment comes, though, we will raise awareness of brain tumors and their symptoms because increased awareness can lead to early detection and with that, the best possible outcome for every patient. I am a nurse by profession and have worked with patients and families facing a diagnosis of brain tumor for over 25 years. It has been my privilege during that time to have worked collaboratively on many educational projects and advocacy and awareness projects with Brain Tumour Foundation of Canada. So I can report to you firsthand that they do wonderful, effective, important work in supporting patients, both adults and children, and their families from the time of their diagnosis, providing information and education through the provision of their comprehensive patient handbook, which is given free of charge, to resources for talking to children, and through a very dynamic variety of programs such as their patient information days and online webinars. This is just a very short list of the services they provide. In addition, as Canada's only national brain tumor organization, Brain Tumour Foundation of Canada has also been a leader in advocacy and awareness issues. Also, I am now very honored to be a contributing member, I hope, to the board of Brain Tumour Foundation of Canada. In being here today, we are joining our voices to raise awareness of this often devastating disease and providing hope to the people in Ontario and also to all those patients across the country who've been affected by a brain tumor. I am committed, along with everyone involved in Brain Tumour Foundation of Canada, to continue to raise awareness and to bring hope to the future. There is much to do, and with your help, we will end brain tumors. In closing, I would just really want to express our heartfelt thank you to MPP Chris Ballard for his advocacy and leadership on behalf of this motion. Thank you.
Very good. Thank you very much, Maureen. Now I'd like to welcome and introduce our second guest speaker, Ben Diplock. Ben works as a clinical research coordinator at Sunnybrook Research Institute, and he's also a brain tumor survivor, and as I mentioned earlier, a former neighbor. Welcome to Queen's Park.
Thank you. And thank you all for having me here. It's a real big honor. In 1998, at the age of 8, I was diagnosed with a benign brain tumor. I was operated on at Sick Kids later that same year. In reality, if I had had a tumor, say 50 years earlier, my likelihood of survival would have been markedly more grim. Instead, I stand in front of you today, owing my life to patients, survivors, family, friends, and professionals, as well as the remarkable work and advances in the Canadian healthcare system. After the operation to remove my tumor, my parents were told that I would never be able to ride a bike, drive a car, or learn at the same pace as my classmates. Now, I was fortunate enough to be surrounded by healthcare providers, loved ones, and mentors who instilled in me the belief that I was capable of anything to which I put my mind to. And with this positivity, I learned to ride a bike, drive a car, and graduated from university with honors. Passion and drive have been the byproducts of my past experiences. My disabilities have been transformed into unique abilities. I've been provided the opportunity to do meaningful pediatric brain tumor research 2 summers ago at Sick Kids. I now conduct treatment research with adults with brain tumor survivors at Sunnybrook Hospital, kindly funded by the Brain Tumour Foundation in Canada. I couldn't ask for more than to dedicate the rest of my life to providing support that was once provided to me, and to help improve the lives and hope of individuals with brain tumors. I see awareness as one of life's great, rare, and unbelievably powerful gifts. When awareness is shone on problems, this light has the power to uncover previously inconceivable answers to complex questions. With the launch of this bill today, and hopefully the promise of May being titled Brain Tumour Awareness Month, I have hope for a brighter future, with the potential for bolstered research funding, research in general, knowledge dissemination, and eventual change in healthcare practice for a cure, to extend life, and to improve the quality of life. Thank you to all the past, present, and future advocates who have made and will continue to make immense improvements in the lives of others. I can't wait to see what the month of May in the future will bring in the coming years. Thank you.
Very good. Thank you very much, Ben, and for your comments. I'd like to introduce Charles Mott. Charles is from my riding of Newmarket Aurora. Welcome to Queen's Park, and look forward to having you tell us a bit about your journey. Charles is also a brain tumor survivor. So, Charles, over to you.
Very good. Thank you so much for having myself, and also with me today is my wife, Rebecca, who's been a tremendous support for me. And through these difficult times, you need that. And I can speak to that now. So I was diagnosed back in October of 2014, and it was a complete shock. It was a shock to me, my wife, my family. And, early on, it was a lot of questions, and we needed answers. I thought, if you take your health away, what are you left with? And it was very difficult. So we put our energy into learning and educating ourselves on how to handle this. We wanted to become confident, and we wanted to put together a game plan. And we couldn't do that without the help of the team at Sunnybrook and Princess Margaret Hospitals, and also the Brain Tumour Foundation of Canada, where we reached out to them, and it felt like they just dropped what they were doing to help us. And that was the impression I got. Right away, we got a lot of information and literature in the mail, which helped us put together this game plan. We needed to do this because you can get lost, and that's the feeling you get. You're lost, and so they helped us. And so, we didn't really have an off switch. You're on. You're on because you want to become, you want to win. We want to do well in this department. So, even if we're going to take baby steps, eventually, we're going to get there. And so, they've been a great player in our situation. So, I want to say thank you for having us here today and building more awareness. So I just want to show my appreciation by saying thank you.
Very good. Well, thank you very much, Charles. So as we wrap up here, I wanted to thank all the speakers we've heard from today for their support of this bill. Certainly it's been my honor to speak at this time. And if anyone has any questions, we have some experts here who would be quite happy to take them.
Sorry, so October is not currently Brain Tumour Awareness Month.
October is currently a Brain Tumour Month. I believe it was 1999 or thereabouts that the province passed that. But just to bring a North American-wide perspective, May generally is the month that is dedicated to it. We are simply going to amend the original act to make May the month.
And if you don't mind me
Jump in.
adding in, other than the fact that it's my birthday's in May, so I like
Oh,
that.
okay. It's also the Ben Diplock.
Yeah, of course.
Awareness
in the
Month.
Diplock. I think more importantly, being able to create kind of a uniform opportunity to shed light on these issues is really important, right? Particularly for, I think, funding into that area, because there can be larger sets and groups can kind of come in and actually put a lot of money forward towards projects that maybe need a bit more funding to really have a big effect. So I think that's the biggest reason why I think this is really important.
Absolutely. We want to align with what others are doing.
exactly. Much
So-
more eloquent way of saying that, but yes.
No, you said it best. Thank you. Well, going once, going twice. Thank you very much for those at home who've tuned in. We're around. Take care. And thanks again, everyone, for being here.
Thank you.
Thank you.